the cypher stenting trial. William?
Thank you very much, Chairman. Dear colleagues, good morning. This slide is a list of my disclosures. So in a couple hours I will be reporting the primary results of PROTECT, and as I speak, the Lancet will be publishing online the full report by Kamenzint and Steg on behalf of the PROTECT Steering Committee and investigators. PROTECT trial stands for stent thrombosis and major clinical events at 3 years after zoterolimus-eluting or sirolimus-eluting coronary stent implantation, a randomized multicenter open-label controlled trial. This slide has a lot of information with the study design. The hypothesis was that the long-term safety in terms of definite and probable stent thrombosis at 3 years with Endeavour implantation would be superior to cypher. PROTECT included real-world patient with an indication of PCI on single or multiple coronary artery lesions with virtually no limitations on number of lesions of vessels to be treated. The trial enrolled 8,800 patients, randomized 1-to-1 to be treated either with Endeavour or cypher. As mentioned, the primary endpoint is a composite of definite or probable stent thrombosis at 3 years using the Academic Research Consortium definitions of stent thrombosis. In order to capture the main clinical sequelae of stent thrombosis, principal secondary endpoints were listed, namely various combinations of death and non-fatal myocardial infarction. Details of the trial design have been published in 2009. I'd like to stress that PROTECT is the largest randomized clinical trial comparing DES today, and it's also the first trial reported that is adequately powered to compare stent thrombosis between drug-eluting stents. Let's go straight to the main findings. The trial was powered to detect a 40% reduction in stent thrombosis at 3 years, and this is based on anticipated stent thrombosis rates of 1.5% with Endeavour and 2.5% with cypher. The study found no significant difference between stent thrombosis rates at 3 years between the two devices. As a matter of fact, stent thrombosis rates at 3 years were low as anticipated with Endeavour. Stent thrombosis rates at 3 years were lower than anticipated with cypher. The main principal clinical endpoints and other endpoints are listed here, showing no difference with respect to various combination of death and MI, stroke, bleeding. Revascularization was increased with Endeavour, be it measured by target lesion or target vessel revascularization, and accordingly, MACE was also significantly different. However, overall event rates were low in both arms at 3 years. Pre-specified exploratory time analysis up to 1 year and between 1 year and 3 years shows that a difference in late stent thrombosis, in very late stent thrombosis between devices emerges over time. This finding stresses the importance of continued follow-up as planned up to 5 years. So in conclusion, PROTECT is the largest prospective randomized head-to-head comparison between drug-eluting stents presented so far and demonstrated the following. There is no difference in definite or probable stent thrombosis rates at 3 years between Endeavour and cypher. Other clinical safety and efficacy endpoints are also low and were sustained out to 3 years. The time analysis that I just showed suggests that the difference in stent thrombosis between groups is emerging over time, emphasizing the importance of continued follow-up. And the lesson we've taken from these results is that large pragmatic trials such as PROTECT are essential to determine differential outcomes between drug-eluting stents, and also they're needed if we want to capture the impact of improved procedural and clinical practice on stent thrombosis rates over time. Thanks for the attention.